Whenever I see your smiling face, I have to smile myself because I love you.
Hi, welcome back. I'm Dr. Margaret Ames. I'm a dentist in private practice in Greenlawn. You can reach me at 631-261-4525. We've just been talking about state-of-the-art dentistry, new techniques that are 21st century. I've been practicing dentistry in Huntington, New York for the past 20 years. I'm also the founding president of the Academy of Biomimetic Dentistry. That's a hard word. Bio means life, and mimetic means mimics. So the only thing that really encompasses the process of rebuilding a tooth is a name that says what it is, biomimetic. So I'll also call it minimally invasive or tooth-conserving dentistry because it's easier concepts to remember. So I'd like to talk with you now about a new kind of dentistry that's steadily replacing what patients have always thought about dental restorations. This biomimetic dentistry has many advantages over what you've become used to. Biomimetic dentistry is minimally invasive. It's conservative. It values the life of tooth structure over the life of the restoration. And it's already being the sought-after treatment of choice among informed patients. Let me explain what I mean. One of the things about biomimetic dentistry is that you'll notice that when you had a filling when you were 6 years old, at some point, that filling had to be replaced. And at some point, it had to be replaced again. And for many people, those of you driving around in your car and thinking about your last visit to the dentist, you fear the thought of a root canal. That's not a great scenario, but it's one that we have become used to. I think of biomimetic dentistry as failing safely. So when something has to be replaced, you want to just replace that restored part. The best example I have of this is automobiles or bridges or airplanes. Automobiles were designed, my Uncle John had a 1954 Chevy, Bel Air or something. It was built like a tank. If it had been in a collision, it wouldn't need much body work because it was so strong. But what happened is that people died. People got whiplash. People were hurt seriously. And the car escaped without much more than a dent. So as insurers and doctors became more aware of what was happening, the automobile industry designed the cars to fail safely. So now you'll see in a collision that the front end might turn into an accordion, all cramped up, and the trunk, all cramped up. But the place where the important part sits, the people, that remains intact. It's a cage around to protect the important part. That's failing safely. You can replace a car. You can't replace a person. In dentistry, you want to keep the tooth alive. You never want to have a root canal if it can be avoided at all. Actually, my endodontist, to whom I refer, thought for a while that I didn't like him anymore. Because doing this new dentistry, I was sending him so many less patients that he said, "What happened? Do you have a new endodontist that you're sending your patients to?" And I said, "No, it's just that with this new way of doing dentistry, they don't need it." And he thinks that's fantastic. So I'm happy that he's on board with this, even though he doesn't get as many patients from me. So let me explain what biomimetic dentistry is. In conventional dentistry, a tooth is treated using techniques that use mechanical restoration. Think of how a woodsmith would join two pieces of wood for a strong joint. The best technique would be a dovetail, where the shape of the joint guarantees its strength. It's good for a chest of drawers, but not so much for dental restoration. The reason is that in woodworking, no one cares much about the amount of wood being removed to fabricate the joint. Wood chips and sawdust are expected. But in the dental world, this kind of excavation necessitates the removal of healthy tooth structure just so that the restoration will hold. In the old days, that made sense, and that's what dentists were taught for years and years, and are still being taught. However, doing this and using the age-old stalwart of silver mercury amalgam actually sets the stage for the restoration to fail. With temperature changes, amalgam fillings expand and contract, and over time, they cause the teeth to crack. It also leaves paths for bacteria to enter the tooth, get under the amalgam, and continue the process of decay from the inside. Pretty soon, you're back in the dental chair getting your restoration restored. Over time, this leads to root canals, crowns, and even extractions. Now, we take x-rays as needed. There's very little radiation with dental x-rays, but when they can find a problem early, it's valuable. If you wait until you have sensitivity to cold or hot, the nerve is then affected. This is like in the car crash, you want to keep the passengers and the driver safe. In a tooth, you want to keep the nerve safe. So you never want to wait until you have sensitivity to hot or cold or chewing to have your tooth restored. That's the advantage of finding things early so you can do it in a minimally invasive way. With biomimetic dentistry, amalgams are a thing of the past. I don't plug potholes. I don't need to mimic woodworking. Rather, I'd rather mimic natural oral anatomy. 25 years of research in peer-reviewed journals like the Journal of Prosthetic Dentistry, the Journal of Dental Research, not the free ones that we get with all the advertising in them. These journals and the research have changed the paradigm where amalgams are replaced by the techniques of adhesion, advanced adhesion. Using air abrasion or lasers, only the decay is removed. No drills, no pain, and the healthy portion of your tooth structure remains intact. To this healthy tooth structure, I place materials which recreate the natural, rigid, and flexible portions of the teeth for they're adhesively bonded with a bond so exact that the distance between it and the tooth is too small for even a single bacterium, that's the singular of bacteria, to get through. You can see the difference. The result is no mercury in your mouth, no tooth sensitivity, and your mouth is more aesthetically pleasant. And your overall tooth anatomy is more like what the body expects. And over the lifetime of a single tooth, you can save thousands of dollars. That's why it's becoming the sought-after treatment of choice among informed patients. I invite you to call my office. I'd like to tell you about what our new patient experience is like. When you come in for the first visit, we schedule an hour with you. I like to get to know my patients and to see what their past experiences have been, what their values are, to talk to them a little bit about what I think is important and what treatment plan would be good for them. We do an oral cancer exam. We examine the muscles that you use to chew. I do a range of motion to see how wide you can open and how far you can move your teeth from left to right to see how your temporomandibular joints are. You've heard of TMJ. I check the bite to see if teeth are colliding into each other rather than gliding over each other. I ask about headaches because some headaches are directly related to the position of the lower teeth to the skull. The upper teeth, they're implanted in the stable, the immovable part of your skull, which is the upper jaw. The lower jaw moves around, and when your lower teeth fit together with your upper teeth, that affects the position of the joint. So we check all these things. I look at how your gums are. If your gums are bleeding, if they have recession, bone loss, I make a plan and talk to the patient about what they can do. And I always say to them, I could give you a briefcase full of things to take home and start to clean your teeth. But nobody's going to do that. We have a life. So I say, let's custom make the home care regimen for you. And I take photographs along with any necessary x-rays. I'll take photographs and I'll sit with the patient for a half an hour and I'll show them and listen to their questions, answer their concerns. And together, you and I will make a plan which identifies your problems now and make a lifetime plan for how you're going to keep your teeth, avoid root canals and crowns. So I invite you to call my office. I'm in Green Lawn, New York, Long Island. My number is 631-261-4525. That's 631-261-4525. I want to teach you about the current techniques. I want to tell you the preferred treatment methods. And I want you to have a comfortable and enjoyable experience with my wonderful staff from Marion at the front desk, who welcomes you into the practice, who helps you to obtain your x-rays, to maximize, if you happen to be lucky enough to have dental insurance, maximize your insurance benefits so that you're getting the benefit of what your employer has given you as part of your benefits of your job. Then we have Bonnie and Barbara. Bonnie's been working with me for my whole time here in Huntington. She travels from Patchogue to Greenlawn. She drives there every day because she values the kind of dentistry that we do. Bonnie's great. I appreciate you all. Thank you for listening. Tune in next week, Saturday, 10 a.m., Long Island News Radio 103.9. Call my office, Dr. Margaret Ames, 631-261-4525. Thank you for listening, and I look forward to hearing your questions, and I'll address them on the show in future shows. Thank you very much. Enjoy the rest of your weekend. Bye-bye.